Greetings from Detroit, Michigan. Thank you for joining today for Making Connections, Breastfeeding Peer Support in Community, Virtual, and Clinical Spaces. WIC breastfeeding peer counselors have a special and unique role in breast chest feeding support for families who participate in the program. The need for increased access to breastfeeding education for those who are pregnant and support for families on their parenting journey has been magnified during the COVID-19 global pandemic.
Hi, everyone. I am Kadada Green, the founding executive director of Black Mothers Breastfeeding Association, and I am so happy to be here with the national audience of WIC. Joining me is Erica Davis. Erica Davis, tell them about your role at this moment in time.
I'm excited to be here as well with this national WIC audience. And so my current role is as a WIC breastfeeding community liaison, working with Black Mothers Breastfeeding Association, providing that community connection, and also with our local hospital and prenatal clinic, providing the support in person and at the bedside.
Wow, that really sounds detailed, right? Because when I think of peer counselors, I tend to think of peer counselors who do home visits, right? Who do like one-on-one support in the home or when people go to the office. But your role really encompasses a lot, and I'm really, really excited for the audience to learn about that. Today, we're talking about making connections. And I think it's important for us to kind of back up a little bit, Erica, to talk about how you and I made our first connection.
Yes, absolutely. So I was fortunate some years ago, I want to say it was in 2015, and I was working as a breastfeeding peer counselor at a federally qualified health center here in Detroit. And the program had been going for a couple of years and there was already a peer counselor in place. And she said, well, you know, we need to get Kadada over from Benfa over here to meet with us and talk about how we can grow our program. And so I remember you came over to the clinic to meet with us and just listen to, you know, kind of our vision for what we had for the program, and just you being so gracious to say, you know, whatever you all need, Benfa is here to support. And I always remembered that, and it's been going ever since. So in that role, any events that we had, Benfa was always there to support. And so I'm so glad for us to be working together now in this capacity.
Yeah, and it's interesting that you should say that, because we talk a lot about making connections. We talk a lot about networking, right? And how to collaborate in this space. And that's what the presentation is about. But sometimes you just don't know how, right?
Right.
And what I'm hearing from you is that you wanted to collaborate with Black Mothers Breastfeeding Association, and we didn't know how at the time, right? We didn't know what that looked like.
No.
And a lot of meetings about collaboration I have, they start off with just that, just brainstorming, like, hey, let's see if something clicks. If it doesn't click now, maybe it'll click later. And that's what happened. And so before we go into that, I want to tell the people a little bit about Black Mothers Breastfeeding Association that has been around since 2007. I think I got that right. Yes, 2007.
Yeah.
I'm really, really proud of that. We are a community-based organization. However, we do our local work here where we have impact, and we also do national work. But really, all of our work is based around our mission. We're really, really mission driven, and that mission is to reduce racial inequities in breastfeeding support for Black families. And so, Erica, when you all reached out to me, I thought, hey, you know, I'm in Detroit, FQHC is in Detroit, and we're all working with Black families, right, to support breastfeeding. And so that's why the partnership was important to me. So thank you so much for reaching out. I just remember sitting in that room and how beautiful it was. It was just so welcoming to families. And so I really felt welcome there. And I felt like this was a space where families would feel wanted, families would feel needed, and then they would feel like they were in a trusted environment because the folks
Absolutely.
they had taken time to make it look right, to make it look good and presentable and welcoming.
Yes, I definitely remember that chair in that room was such a comfort. It was just such a relaxing environment.
Mhm. So we didn't know what to do then, but we kept our connection together. I remember, it's something about, you guys will get to know Erica as we go through. Erica has this really bubbly, welcoming, fun personality, and she keeps us laughing all the time.
Well,
It's
thank you.
Yeah, it's a subtle humor. It's a subtle humor, and I'm sure we'll hear some of that throughout the presentation. But I know there were opportunities for scholarships and things, and so we kept in contact as BIMPA would have things in the community as well. And I remember us wanting to do. We were doing pop-up Black mothers breastfeeding clubs around the city, and what that meant and what that looked like is, hey, we would reach out to community partners, or we would respond to community partners who had reached out to us, and we would pop up at their site, right? Because we want to make breastfeeding support accessible, and Detroit's a large city. And so we thought that one way of doing that was to do pop-up breastfeeding clubs. And they were pretty successful. Do you recall the one that we had at the FQHC when you were there? I don't remember if it was 2018 or 2019 when we did the pop-up breastfeeding club.
Oh, yes, I think that was early of 2018. And I do remember. So you mentioned like this, the things of all the things that were available at the time. So when you guys were doing conferences, and I would get a call to say, hey, come to the conference, we'll give you a scholarship to come to the conferences. So I had just been following you guys, watching all the collaborations, seeing all the cool things going on. And so when this opportunity came up, we decided to do the pop-up head wrap party. And so we met at our East Side location. And that's what it was. It was just a head wrap party, and moms came and we had food, of course. We had fellowship. We had a good time. We learned how to tie these beautiful head wraps, which is actually a skill that I continue to utilize in my own life pretty often. And it was such a good time. And what I really loved about it was we were able just to bring moms together who were already coming to events, bring them together in one event and just have that fellowship at that time. So that was a really special event for me, for sure.
Yeah, it was good to connect. It was a BIMFA. You guys, you probably realized by now we call Black Mothers Breastfeeding Association BIMFA for short. It's easy. So the connection was a community-based organization connecting with an FQHC, and
Yes.
so both are doing work in the community, and it was amazing. Our relationship continued though, Erica, and we would see each other in spaces as we're doing this work throughout the city. But our former board president had the idea of bringing a WIC community breastfeeding liaison to BIMFA. And she worked at a hospital. And at that time, the Michigan WIC office was offering the breastfeeding liaison in the hospital. And so her idea was, if this is good for the hospital, if we can put a staff person in the hospital, what about in the community? And we began conversations with the leadership at WIC, and from there developed this role, right? You give part of your FTE to the community, in partnership with BIMFA. So tell us a little. So Erica, we interviewed, right? We didn't just say, "Hey, Erica, here you are," because at that time you were no longer at the FQHC. You were at a different with a different employer, and I didn't know you were going to apply, but we had several great applicants, and you were offered the job, Erica, after the application process and the interview process. So what was it about the position that interests you? And then just tell us a little bit about how that works, like how your role as a liaison works with BIMFA, with other community organizations, as well as you mentioned you work in the hospital setting now, and also Michigan WIC. Talk a little bit about that.
Yeah, so as you mentioned, at that time when the position was posted, I had moved on to another role, and I was fulfilling a role as a community health worker, working in an infant mortality reduction program. And so in that program, I was still doing a lot of the things that I loved, right? Talking to families in the community, and I was always weaving in, right, breastfeeding. How can I talk more about breastfeeding? How can I make sure that this is something that people know is so important to do? And so when I saw the role posted for breastfeeding community liaison, I thought, wow, this is kind of like me being having a chance to just kind of bridge everything that I'm really passionate about and what I'm kind of already doing. And then also getting back to my first love, I guess, which is breastfeeding education. So I thought, well, I like what I do now, but I really think I would love this. And so that's what led me to apply for that role. And so, of course, this role was thought about before COVID hit. And so I got into the role right before the pandemic. And so the idea is that as the community liaison, I would be able to bring breastfeeding support and information to organizations such as early Head Start centers, parenting programs that we have in our city, and then also in the hospital part of the time during the prenatal visits. And then at the bedside, again, just offering that support and other education as well. So I just thought it was so unique how all of these things are woven together. And so that's kind of how we got going, is that I'd be going to these different community sites, into the hospital, into the prenatal clinic, and kind of seeing how we can just make things much more accessible.
It just came to me that we were talking about the pop-up Black Mothers Breastfeeding Club, right? At the time when you were in the FQHC, and the idea of BIMFA doing pop-up breastfeeding clubs was to make it more accessible. And now it's almost it almost kind of just hit me. So maybe this is just really ingrained in what we do, that I don't necessarily think about it until we're talking about it, is that um you are wearing many hats and moving around the community, um and making this more accessible, right? Because we talk about location in this work, we talk about accessibility and availability, and just because something's available doesn't mean that it's accessible, and we have to make those connections. But what I also hear you talking about, Erica, and we're going to talk a little bit about our own personal experiences in breastfeeding, is that this was already kind of a part of what who you are and what your passion is. So let's talk a little bit about that.
So in this picture, you will see me with my little baby, probably, oh goodness, she couldn't have been more than 6 months. And then on the left, you'll see my grandmother, my maternal grandmother. So I'm really proud to say that I come from a long line of breastfeeding women. And so my grandmother here that you see, she also had a mom who breastfed. And I was able to actually witness my own mother breastfeed for about 18 months, my youngest sibling, and he's now 14. And so this is my why. This is why I'm in this work, because I, like you were mentioning, we don't always think about what we're doing. But once I became a mother and I realized that breastfeeding has to be talked about more than it is, I was just on my way with my passion to just keep this conversation going. And so this is my why, and this is why I do the work, is because it's really my family's legacy.
Mm. Oh, that's very interesting. And I think that you and I have different experiences as far as our family and breastfeeding, but I think it's really very important. And I like that you brought your grandmother into this conversation. She's beautiful. Your daughter's beautiful.
Thank you.
I think the intergenerational part of breastfeeding is really important in our community. I too got into this work of breastfeeding through passion, right? I've always had a passion. I feel like my inherent um, responsibility or leadership or advocacy or community organizing for Black people has always been there, right?
Mhm.
I'm a former educator. Well, I shouldn't say former. Once an educator, always an educator. But I worked for Detroit Public Schools for 12 years, and the work overlapped, the time frame overlapped with the timing of Black Mothers Breastfeeding Association for 5 years. And so I selected Detroit Public Schools because I had that desire, I had the passion to really help Black families, and I was really intentional about studying and practicing elementary education, because it's something about the earlier years of life that seemed like
Yes.
it would be like most impressionable for folks. And so this is a picture. I remember when I used to wear this ponytail. I had this fade. I went through, I would go to the hairdresser and I would get this like side ponytail. But this is
Wow.
a picture of me and my two beautiful daughters, who I'm so really, really proud of. And my oldest daughter, I nursed her for 15 months. And I was really proud of myself, but I also felt bad that I only nursed her for 15 months. And I know we
Oh,
say,
wow.
oh, only, right? Like that's such a huge goal in this society that really puts up barriers for breastfeeding and makes it really, really difficult for people to have even to initiate, but especially have an extended and I don't even like the word extended breastfeeding, right? Because it's just breastfeeding, but to breastfeed your child for over a year. So I felt like I could make myself feel better by nursing my second child for longer, and I did. And so now my guilt is somewhat resolved. And so I nursed my second baby for 2 months. I remember on her first birthday, I had been talking to her for about a week, right? Like, hey, your birthday's coming up. Your birthday's coming up. You're going to get your last gift, your last nursing gift.
So she was 2 years old.
She was 2 years old.
Okay.
Yeah, and so I talked to her about what was to come. And then the day came, and that was the last day. And I was expecting it to be really, really difficult to wean her, because it was like a tragedy had happened when I weaned my first child. And maybe that's part of why I felt guilty. It was just really a hard weaning experience. But my second child, it wasn't as hard as I thought. So I say that I don't know, each experience is different. And like speaking of experiences, um, although my mother didn't breastfeed her children, she's been so supportive of me breastfeeding mine, to the point where she helped to co-found Black Mothers Breastfeeding Association. She just
Love that.
really, I know, right? The intergenerational experience. And I'm just saying, we're making connections, we're talking about things. Let's connect with grandmamas, because they play a very, very important role in the experience. It would have been really difficult if I didn't have her support. And so I'm grateful for that. And she's a fierce breastfeeding supporter. So yeah, I'm happy. Thank you so much for bringing your grandma into this space. But while we're talking about grandmas, I am going to say this, because my paternal grandmother had 15 children.
Oh, wow.
Yeah, and she nursed each of them for some periods of time. These are the stories I'm getting. She passed when I was 6 years old, but my daddy is the eldest of the 15 children, so he has memories. And then my grandfather, who passed early in 2020, unrelated to COVID. I just want to put that out there. But he passed, and I actually talked to him about it, and he remembers. And so each of them,
Yes.
isn't that amazing? Each of them had some breastfeeding. We don't know how long. It, from what I gather, it was like initiated and started in some periods of it. In my mind, I gauged from like 2 weeks to 3 months, but that's just
Mhm.
based on what I'm putting together and from what I hear from my dad and my grandfather. So yeah. We're really happy to share a little bit about our personal selves with you guys. I think that'll help us as we move through this presentation. And with that said, we have a few objectives. I think we've already started our objectives, but our objectives here, we have four. We're going to talk about what is a breastfeeding peer counselor, to describe the role and scope of a breastfeeding peer counselor, and how they serve as a liaison between families, community, and clinical settings. I think that's key in a presentation, right? Because sometimes when we think about breastfeeding peer counselors, we're really just thinking about the individual counselor with the mama and a baby. But really expanding upon the way that we think about peer counselors is with the families, the community, and the clinical settings, Erica. That's pretty deep.
It is. We will get into it.
Yeah, absolutely. And we're going to talk about cultivating partnerships. We're going to continue to talk about cultivating partnerships to describe how to cultivate partnerships amongst community-based organizations and clinical settings, and understanding how to utilize virtual spaces during COVID-19. Unfortunately, we're still dealing with the pandemic. We know the restrictions have been lifted, mandates have been lifted, and recommendations look different throughout the country. But we also know that the virtual space is here. People utilize it. It has benefits of flexibility. It has benefits of and some downsides of accessibility, right? But we're going to talk about that. And so we're going to state creative and innovative ways that to engage breastfeeding support in telehealth and virtual spaces. And our last objective, impact through innovation. We are going to explain how technological innovations can be used to effectively inform program service delivery and positively impact birth and breastfeeding outcomes.
So now we're going to get into what exactly is a breastfeeding peer counselor. And I know this National WIC audience, many of us know the role that breastfeeding peer counselors play. But we'll get into more about why this role is so special. So we know that breastfeeding peer counselors provide basic breastfeeding information. They can support the family on how to involve the family, the entire family in breastfeeding support. We help with things like returning to work or school, tips on how to maintain a milk supply. And usually the peer counselor is representative of the families that they're serving. They come from the WIC's target population and many times have similar lived experiences of the clients. And so peer counselors are accessible in the community usually. They may answer warm lines in the evenings. They're accessible usually outside of the typical clinic hours. And so breastfeeding peer counselors also have a special role is that we are the first line in many cases for breastfeeding support, but we know when to refer to skilled lactation professionals when it's appropriate. And so the role of the breastfeeding peer counselor is really just to cheer parents, right, to reach their goals. And we're able to do that because we've experienced many parts of the journey. And so in short, a breastfeeding peer counselor is really someone who knows, you know, what it's like to establish a milk supply or get ready to go back to work or work with a grandmother or a caregiver to make them understand why you wanted to continue to provide your own milk and things like that. So in my role as the breastfeeding community liaison, I'm able to help families to reach resources that are necessary in the early part of their journey. So we'll talk later about one of our partnerships that we have with Early Head Start. And so having that warm handoff to say, well, I'm going back to work or school. And as the liaison, I can say, well, here's a resource that you can look into, right? Because we know that this particular organization, they're welcoming breastfeeding families. They're understanding about how to prepare and provide breast milk in the childcare setting. So those are some of the kinds of things that I am able to do as a liaison. And so again, making sure that the support is accessible. So as we mentioned earlier, pre-COVID, we had these ideas that I would be on site, right? At Early Head Start with organizations who are helping families who may be experiencing homelessness. And so being able to be in places that normally people can't get breastfeeding support right there on site. And so also one of the things that I just love to do as a liaison is to be that peer support there available during Black Mothers Breastfeeding Club. So for example, this is a mother-led group. Moms are communicating about all aspects of parenting and breastfeeding, and then I'm there to provide additional support and education. And so it's, again, another opportunity to foster community kinship And again, keep the conversation going about breastfeeding so that families can reach the goals that they have in mind. And so we have some research behind us, right? Over the years, research has sort of helped make the case for breastfeeding peer support. And so in the study titled Clinically Integrated Breastfeeding Peer Counseling and Breastfeeding Outcomes, which was published in May of last year in the Journal of Perinatology. So this study examined the impact of increased breastfeeding support as part of the maternity care practices. So the study used baseline data of patients from 2014 to 2015 compared to the post-implementation group of patients from 2017 to 2019. And so what was measured were the rates of initiation, duration, and exclusivity of breastfeeding. And then some of those measures were also stratified by race. And so the findings of that study revealed that rates for those who received breastfeeding peer counseling remained similar to the baseline rate, but it did increase from 86 to 89%. The rate of exclusive breastfeeding increased though from 21 to 31%. And so that's a significant amount of gain there. And probably most remarkable in this study is that the overall rate of duration of any breastfeeding for more than 6 weeks, increased from 29 to 65%. And that rate was even more so improved for Black and Latinx patients who showed the most improvement. And so, research tells us kind of what we already know many times, but we know that peer support makes a difference, especially when it's available in a variety of different settings. So now we will get into what Kadat and I have been leading towards a little bit already, is partnerships, right? And partnerships are a critical way to integrate breastfeeding and peer counselors in a variety of settings. So you may have a lot of different parts and moving pieces and challenges, but ultimately the development of partnerships is worth it for those who benefit from increased access to breastfeeding education and support. So again, just going back to earlier, Kadat and I discussing how we didn't really know how we were going to get together, what we were getting together all those years ago. But we knew that we shared a lot of common goals, and we knew that we were going to be working with these families, and we knew that somehow it could come together with some consistency there.
Yeah, Erica, I'll add that we don't always want to think of partnerships as sometimes people fear partnerships because it sounds like more work, more labor, right? And I know everybody who's listening is stretched. This is
Absolutely.
the way the system works, but taking time to learn about what one another does, there's value in that, because if we think about partnerships in a way and making these connections in a way that, first of all, it best supports the families, right? Like that's the key. That's what we want to do. We want to make sure that we have all those building blocks to support the families. But we also want to do it in a way that it doesn't make more work for us. So finding where you fit is important, and it doesn't necessarily have to happen overnight. Like it could be a referral. Like we know now we can make this referral, or we know that this FQHC is more accessible to this mother, or we learn about other programs that are happening over there that are helping our families, and that's done through communication and collaboration. So yeah, it's a process, but I want you all to think of ways that it's low labor, high impact when you're thinking about partnerships and collaboration.
That's an excellent way for people to remember why this is so important. Low labor, high impact. Absolutely. And so one of the things that we have here are just some questions that you can ask when you are getting together potential partnerships, right? So you decided maybe you want to work together, but decide what is our goal? What are we trying to do? So for example, our goal and our collaboration here is increase access to breastfeeding education and support. And so also you always want to bring in the community that you're going to be working with. Find out, what do they need? What do they already know is working? What have they tried that needs support and improvement? And so some of the ways that we have done that is just by doing things like surveys, town hall meetings, and just giving opportunity just for the community voice to be expressed, to people to get together and say whatever it is that they're thinking about their own community. And then also we're always building a network. Again, we kind of said this already, but who is doing similar work? Who is working with the same families? And so when we are approaching this partnership as Liaison, I know that many of the families that I'm working with are going to be going over here to this early childhood center. They're going to be going here for this parenting program. And so we're all in communication together. We're all building a network, and we're all staying abreast of what we can offer families and how we can continue to foster that support for breastfeeding. So here we'll see some examples of partners that we are working with currently. And so at this time, our partners include early childhood education, again, OB clinics, offices, hospital settings, shelters where families may be experiencing a variety of things and are being temporarily housed, and parenting programs that may follow families from birth to 5 or birth to age 8. And so here you see a flyer for an event that took place last month during Black Maternal Health Week. And events like these just give voice to the community, to share the stories, express concerns, and again, have fellowship around issues that we feel are important. And so during this time, we've also been able to hold 3 virtual open houses, which served as a way for our partners to join with Benefit to share information about resources that they have available, share updates about their programming, and for Benefit to, again, do the same, just to let people know what's available, what's out there, and how we're all planning to stay connected. And so here we kind of can see the different ways that a breastfeeding peer counselor can be integrated into a variety of different settings. And so as my role as the liaison, we had to make some changes once COVID hit. Things that we had set up could no longer be delivered in a face-to-face capacity. So we had to shift and decide how things were going to be brought to families again, so that there weren't gaps in support. And so some of the on-site activities you see here to the left, this is an event that we did. It was just demonstrating how to baby wear. And we also gave out baby carriers to participants at this event. But this was held with one of our partners, and all of their programming is in homes that are welcoming to the community that they're set in. And so some of the other ways that we utilized, we had to get creative, is that we utilized telehealth. There was virtual visits happening. There was virtual meetups. Our Zoom sessions for our Black Mothers Breastfeeding Club happened every week. And so those are well attended, and we know that people were looking forward to having those opportunities to get together, because face-to-face just was not accessible at that time. And so in the clinical setting, some of the face-to-face support remained, but again, just being that first line of support to say, hey, do you know about the WIC program? Hey, have you thought about breastfeeding? Or, oh, what was it like the last time you breastfed? Again, just to prepare families to get ready for the journey. And I'd help them identify any goals that they have already, and also to just make sure that with the ever-changing policies that were happening at that time, families still understood that breastfeeding support was available to them and accessible at that time. And so here you will see some of our virtual events that took place. So again, we were on Zoom quite a bit. And I don't know, Kanat, if you have any feedback to share also about just the impact of Black Mothers Breastfeeding Club going to a virtual space during that time.
You know what? Do you remember we were challenged, right? Because we had to pivot. And when I say that Black Mothers Breastfeeding Club had, so the association started in 2007. Our signature work, the club, actually, I and this is hitting me. Wow, now that I think about it. Okay, so I've been saying that Black Mothers Breastfeeding Club, our signature work started in 2008. And you know why I've been saying that, Erica, for so long? I'm gonna have to retrain my brain.
Oh, wow.
So I've been saying that because we started meeting in person in 2008. But truth be told, we had been meeting in 2007. Do
Oh,
you
wow.
remember? Seriously, if I'm really honest with myself, it kind of started virtually while we were getting the in-person together. Do you remember Cafe Mom? Do you go back to like Cafe Mom then?
No, I'm not familiar with Cafe Mom.
Oh, wow. I'm dating myself. So, okay, Cafe Mom has turned into a smaller platform now since kind of Facebook took over, right? Facebook kind of took over a lot of things that were happening individually, but Cafe Mom was similar to kind of MySpace in back in the day. So it was like
Oh,
Cafe Mom.
wow.
It was Cafe Mom for mamas. It was MySpace for mamas. And so I was home from work. I had a new baby. I was starting this organization, and I was finding adult interaction on Cafe Mom. And so if you can remember how you would interact on MySpace, which I never really got into, right? But there were chats, there were
Yes.
rooms for people. Black Mothers Breastfeeding Club kind of actually started in a virtual space on Cafe. It was part of the Cafe Mom platform.
Oh,
And
wow.
if I go way, way back, we had a chat room on our website. And so we would schedule a time. It was like 9 o'clock at night that mamas could come, they would know we were chatting live at this time. And so we would be on the Black Mothers Breastfeeding Association chat room during a certain time each week, chatting because you knew other mothers would be there chatting. Do you remember chatting online? I mean, we chat now, but it's different. Do you remember this, Erica?
I do remember. I'm trying. There was a name for these kinds of things.
Yeah,
Well, yeah, chat rooms.
it was the chat room.
Yeah,
So we've kind of come full circle. But
that's amazing.
yeah, when I think about it and I really put it all into perspective, to kind of start there, and then when we kind of got our first funding, we shifted to in person. And so all the people we were chatting with, or most of them, we then met them in person, similar to what's happening now. And so I recall figuring out, like, how are we going to make the shift? Are we going to do it with Zoom? This is when COVID happened. Are we going to shift to Zoom? Are we going to shift? We tried Zoom, we tried Google Meets. We even thought about that. Facebook started creating these rooms. I don't know if that never seemed to work because everybody didn't have Facebook.
Right.
Yeah, we tried a few things and we settled on Zoom, right? And so here we are having virtual events again, which is where we kind of started. I think the difference now is that you're seeing people live or even or just their profiles, but you're hearing their voice or the chat room. So yeah, they say there's nothing new under the sun.
Right. I love that you brought all of that around because it's even making me think of my own, just very early in parenting. And I did utilize a lot of groups and apps for connection to mom. I didn't always go to a lot of things, but you could find me in a group. And so that was one of the things I did sort of think about when we shifted to a virtual group. I was like, oh, okay. It really just made me feel reconnected back to that time in my life as well.
Yeah, we can't be stuck in our ways. And I think that we also have to think about the resources that are available to us. And we're talking about a lot of great ideas, right? Things that we're doing. But some of these things have been spelled out for us, for you all in the blueprint, right? And so I want to talk a little bit about the continuity of care and breastfeeding support. It's a blueprint for communities. And I'm just going to preface it a little bit. The continuity of care is a blueprint that was created through community engagement by NACHO, which is the National Association of County and City Health Officials, and USBC, the U.S. Breastfeeding Committee. And they have put together a continuity of care to kind of give you a blueprint, literally the words that are in the title of the document, to give you a blueprint on how to fill the gaps of care, or how to make care and breastfeeding support continuous. And so we're going to watch a little bit of video, and I'm going to tell you how this involves Erica and I. So yeah, let's take it.
Reducing chest breastfeeding disparities for health equity. Introducing continuity of care and breastfeeding support, a blueprint for communities. Human milk, the normative standard, the ideal first food suited for infants' optimal growth and development. Breastfeeding rates have increased in the United States, but persistent disparities remain. This is due to many unjust reasons that could be solved with an equitable approach to skilled lactation support across the community. To achieve chest breastfeeding equity, we need to tackle persistent inequities for optimal infant feeding and make chest breastfeeding the easy, feasible, default choice for every family in the community. In response, NACHO and the U.S. Breastfeeding Committee, with funding from the Centers for Disease Control and Prevention, partnered and convened over 100 experts to develop a community-wide approach to lactation support, so families are fully supported and do not fall through the cracks during their chest breastfeeding journey. That approach is outlined in a new resource designed specifically for local level organizations that interact with pregnant and postpartum families. The Continuity of Care and Community Breastfeeding Support, a blueprint for communities, launched during National Breastfeeding Month in August 2021. The blueprint uses the continuity of care framework to ensure that support services are continuous, accessible, and coordinated, and that community spaces are proactively supportive of chest breastfeeding. The blueprint features 7 recommendations in 2 areas: improving community infrastructure and building the lactation workforce capacity. Because each community is unique, community members and local lactation support providers should be seen as experts in implementation plans. The recommendations are: number 1, breastfeeding as a community health improvement strategy; 2, breastfeeding policies, systems, and environmental changes; 3, transfer of care accountability and referral systems; 4, community-driven chest breastfeeding data system; 5, public health, allied health, and healthcare workforce education; 6, family-centered care, implicit bias awareness, and cultural humility approach; and finally, recommendation 7, health advocacy and the local breastfeeding champion role. Together, we can improve overall community health and advance chest breastfeeding equity through continuity of care and breastfeeding support. Take advantage of this resource in your community. Go to breastfeedingcontinuityofcare.org today.
I am happy to say that we are a part of a group of grantees who were selected to implement the blueprint, and we do this in a collaborative way. We have Focus Hope, who works with us. They are an early Head Start program. We have Erica here, who's our WIC Breastfeeding Community Liaison, who works in the community, who also, who also works in the hospital to really help fill those gaps. And again, us, Black Mothers Breastfeeding Association, we're all key partners in implementing the blueprint in our community. And as you can see from the video, you can download, you can go to their website and you can download the blueprint so that you can use it as a resource and a way to learn how to fill the gaps, or to look for suggestions, to get ideas and thoughts around the blueprint and implementing it in the community. So let's talk a little bit. We use three of the implementation recommendations is what we are doing. So one recommendation is to integrate breastfeeding promotion, protection, and support goals into existing community health improvement strategies and as a component of health promotion programs. I'm trying to pull up my notes here. Um, all right, I think I got it. So, as a funding recipient of a NACHO award, we are tasked with 3 of these recommendations through our programming. And the interesting part about this is with recommendation number 1, it's really given us an opportunity to try to kind of, I wouldn't say rebuild, because I don't know if the connection was ever like lost with our work with Focus Hope, our early childhood partner, but we were able to bring it back into the community. So it's a co-location opportunity for us. Remember, we talked earlier about us doing the pop-up breastfeeding club. This is similar to that in a way because we co-locate Black Mothers Breastfeeding Club at Focus Hope. And so it's an opportunity for us to work with them as well as to work with them and their families and provide them with support right there at the location so that it's convenient, accessible, and easy for their families to get the resources that we provide, which includes obviously Erica here, our breastfeeding counselor, and our community-based doulas, as well as our mothers, right? They are a key part of what we do. They are really, really a key part of our work. And so here's a picture of us. You can see babies and mamas and kids at Black Mothers Breastfeeding Club with our early childhood partner, Focus Hope. And Focus Hope has an early Head Start program as well as a Head Start program. The next blueprint implementation is blueprint recommendation number 2, which is to create environments that are proactively protect, promote, and support breastfeeding throughout the community in spaces where we live, work, play, worship, shop, travel, receive services, and raise children. We are collaboratively using the Breastfeeding Friendly Child Care Action Plan. We are doing this by administering the Carolina Global Breastfeeding Institute's self-assessment for breastfeeding friendly child care centers with Focus Hope. We are developing and implementing the action plan based on the responses from the CGBI self-assessment. Then we are administering the post-assessment after there's implementation time of the action plan. And BEMFA has been trained to administer the materials of the CGBI Child Care Program Toolkit. However, you can find that toolkit at this website on the next slide. So you can go to cph.unc.edu/BFCC/toolkit. So you can find that, or you could just Google breastfeeding friendly child cares and the Carolina Global Breastfeeding Initiative, and the resources are available there online. Blueprint recommendation number 3 is the 3rd recommendation that we are implementing, and that is to implement a care coordination system across the prenatal through weaning stages. I love it. Because sometimes when people think about breastfeeding, they just actually think about after the baby is here and getting the baby initiated. But we know that the prenatal and its part is so important, and all the way through weaning breastfeeding is a process that needs support throughout it. The recommendation number 3 reads, implement a care coordination system across the prenatal through weaning stages, including the development of formal referral systems, follow-up accountability, and handoff protocols during transitions of lactation care from one provider or setting to another. And we are creating a local lactation resource guide and referral flow chart. So in its draft stage, we are brave enough to share with you our draft because it's a work in progress. And you can see how we put on here all of the partners, not all of the partners, but some of the partners that we are work with and the ones that are a part of this particular work of continuity of care. We're talking about what it is that each partner does at their site. So it's an easy visual. I think this is really important because staff transitions, right? And sometimes that impacts the workflow. But if you have something that you can refer to and go back to, and again, I think of things as always a work in progress. Even though this says draft, one day we'll take the draft off and maybe next year we'll update it. And then in the right bottom corner, you'll see updated 2023. But I feel like there's always room for growth. So here's our shot at creating a referral chart. We're still working on it. We're still in the process of getting it right. And it just really helps to give a visual to the work and an easy reference to who's doing what. We have a community organization here, which is BIMFA. We have Early Head Start program, Focus Hope, clinical breastfeeding support, our WIC breastfeeding community liaison, and our WIC partners. And on the back, you may have seen it just transition a little bit. It happened really smoothly. It talks about why we will refer to each organization, like what would it be that was necessary for us to make the referral. And so it's just good for us to have a visual, and it just really, really makes it easy when staff transitions. So we're going to talk a little bit about peer counseling in a group setting, right? Which is the role of a peer counselor, right? They do one-on-one work, but they also do group work in a group setting like Black Mothers Breastfeeding Club. And again, the peer counselor is providing encouragement and support to persons of similar sociocultural backgrounds, right? And this is important because there are some of the research from CDC tells us that, or some of the products that are published by the CDC shows that when you're working with persons of similar sociocultural background, it actually is very, very impactful. And again, peer support is individually tailored in a culturally appropriate way to promote healthy behaviors. So let's talk about some of the impact of peer counseling in the group setting. The first is there's increased initiation, duration, and exclusivity of breastfeeding, improved community health, reduced preterm birth, and reduce racial disparities in infant and maternal outcomes. And we often think of doulas as someone who helps reduce preterm birth, but peer counselors providing that support in the prenatal setting, peer counselors' roles are also to make connections and referrals, right? So if a mother needs additional support, the peer counselor is that resource. And so that supports mother in making it to her full-term birth. Can you talk briefly about the importance of giving peer education during pregnancy? I can't believe we're almost close to the end of this presentation already. Can you talk a little bit
Sure.
about this?
Yeah, so every mom's journey is to nourishing their baby is different, right? And some have trouble latching, others have struggled with milk supply. We know just how powerful, though, that mommy's milk is. It's boosted for immunity for the baby, lowered illness risk for mama. But the truth is that breastfeeding is just hasn't always been doable for everybody. But we know that it can be, especially at a time as critical as it is right now. So I love the aspect of teaching prenatally. This is my favorite area of space to be in for breastfeeding education, because it's just really a good opportunity to break down the fears that many moms have, or the idea that something that they really want to do just isn't possible. And so this is the time where we build community, we discuss any barriers that could be getting in the way. And again, just how important support is. And so I'm excited to share about our new prenatal breastfeeding education series, which again, this is a new development, right? So we're seeing what works best for the families that we serve. And so this is the Detroit Palm series that you'll see here on your screen. And I just thought of peer counselors. What we do is we just kind of cheer families to success, right? So the acronym is Precious Ounces of Mother's Milk. And the idea is just that during the pregnancy, we'll talk about everything that needs to be covered, what to expect, in hopes that we can cheer families to success. And so the sessions are broken into 3 different sessions. And so ideally, we'll start with building the squad. Who is in the village? And so I find that on my own journey as a parent, this is something that I try to bring to families, is that you got to build a village. You got to have some kinship and fellowship and know where to go for things when you may need a little bit of help or assistance. And so in this session, I'm going to be educating families on why it is important to participate with the WIC program, and how WIC is available to support beginning during pregnancy all the way into, of course, until the child is 5 years old, and the breastfeeding support that is available there. And then also, again, leading families to create that network and village for themselves. And that's through the Black Mothers Breastfeeding Club, which is a mother-led group. And I'm there to provide just additional things, but the group itself is led by the moms. And then we discussed also in this session how having a community-based doula can help you prepare for your pregnancy to get feeding off to a good start. And so I really love collaborating with the community-based doulas at BEMFA. We're able to share and connect, and that way families feel supported from the whole end, from the beginning to the end of the process. And then also, we always welcome the family, the extended family or the larger family. But outside of just mom, we want dads to be there. We want partners to be there. Grandmothers play such a critical role, as Kadat and I were discussing earlier with you. But everyone has to be on board. And this is an opportunity where we can all come together to get on the same page. Additionally, this series will cover learning the foundation. So it's the idea that we're going to kind of take things step by step. And so families can choose which of these sessions they want to participate in. They may feel like some they may need more than others, but ideally everyone will participate in all. And so we'll talk about the birth and the breastfeeding basics, right? We'll talk about making milk. We'll talk about skin to skin. What is normal newborn behavior? And so many of us who work with families know that a lot of times during this period, it's just important to set up families with the expectations of what this could look like in their lives, and work with them to figure out how they can reach their goals. And then also in this series, we're going to talk about getting latched and attached. So early expectations, and again, extending that bonding with baby wearing. And so this is the time for families to ask pretty much any kind of questions, anything that could possibly come up. So for example, They may say, well, what is breastfeeding going to look like once I'm home? What is this going to look like if I have older children, or if I have other things to do, or if my partner is not able to take off and have leave while I'm home on leave? These are the kinds of things that we'll be able to discuss. And then also the support again. Who will support me to continue breastfeeding when I return to work or school? And so what I think is especially important about this is that many of our families may be familiar with creating, for example, a birth plan. And then the idea that you're also going to create a breastfeeding or a feeding plan for once you return to work or school, if that is going to be a part of your experience. And then also, how can I safely wear my baby? How can I continue to keep the bond going? How can I make time in my life to do other things around the house and then also still have time to get that bonding in with a new baby? And so by taking the prenatal series into smaller sessions, I think that's going to be a really good opportunity for us just to help families connect with each other, ask lots and lots of questions, have time to think about things, and then come back the following week. And so this program also is going to provide families with different incentives along the way. And for example, one of those items will be that everyone who participates will get a carrier for the baby wearing as well.
Wow, Erica, you guys are you do such amazing work, right? And I really
Thank you.
appreciate you being a part of the BEMFA team. And as I started the presentation, I talked about how we work locally, but we also have a national impact. And so we have recently created a way to make this easier, effective, efficient, and engaging, right? And one of those innovative tools that Black Mothers Breastfeeding Association launched this year, but has spent the last I don't even know how many years developing, but based on built off of our experience, is the BEMFA Bright Hub. And so I want you guys to find, if this isn't something that you do specifically, right? You can download the BEMFA Bright Hub. You can direct your families to the BEMFA Bright Hub to look for these type of engaging, culturally responsive, peer-to-peer networks on the BEMFA Bright Hub. The BEMFA Bright Hub is really a tool that is available to make hosting parent clubs easier, right? It's so if you have a breastfeeding group or a parent club, we invite you to subscribe to the Bright Hub. But if you are looking to support families and you want them to find a resource that can support them in their early parenting journey, whether they're pregnant or it's designed for people who have children up to 2, ask your families to download the BEMFA Bright Hub and search for local groups in their area. And what I'll say is, because a lot of things are virtual now, even if you can't find something in your community, I'm sure that they can find a virtual opportunity to get the information that they need. So I guess there's 2 parts here. One, can you go back, Erica? One is that if you host a parent club, right? If you host a breastfeeding group and you're looking for a tool to make that easier for you, go to brighthub.bemfa.org and sign up, right? Or email us at brighthub@bemfa.org and we can get you more information. And if you want to connect your families, have them to go to the website or go on Google Play and download us in the App Store, and they can find places, they can find groups that can support them throughout their parenting journey. Erica, this has been an amazing conversation. I'm so happy that we were able to have this, to really go back, right? We started by going back to when you and I met, and then we ended up going back to our grandparents and the start of BEMFA and the evolution, right? And so I'm going to stop here because I think it's a good place for us to stop, because we were talking about starting off in the virtual space in the chat room. and bringing it back to innovation and using technology to support the work that we are doing is important. And so here we are with the Ben for Bright Hub. I'm just really loving the full circle of Black Mothers Breastfeeding Association and also this presentation. If you guys want to connect with me, I am Kadada Green, the founding executive director of Black Mothers Breastfeeding Association. You can reach me at KIDDAG@bmbfa.org or 800-313-6141. Our website is bmbfa.org or blackmothersbreastfeeding.org. Erica, how can they connect with you?
Yes, again, this has just been so amazing. So I look forward to connecting with more people. I can be reached at ericad@bmbfa.org.
Wonderful. Thank you guys so much for joining us. Enjoy the rest of the conference.
Thanks, everyone.